Deep within your chest lies an extraordinary organ, a powerhouse of life. Your heart is a muscular pump, a biological marvel, and the very core of your circulatory system. It's a tireless engine that works relentlessly, ensuring every part of your body receives the nourishment it needs. This incredible organ beats with unwavering rhythm, beating around 100,000 times a day. That's over 36 million times a year. Each beat is a testament to its strength and endurance, a constant pulse driving the flow of life. It tirelessly pushes oxygen-rich blood to every cell in your body, from the tips of your toes to the top of your head. This vital delivery system ensures that every tissue, every organ receives the oxygen and nutrients it needs to function optimally. This constant circulation is what keeps your body alive, energized, and functioning. It fuels your every move, every thought, every breath. It's the engine that powers your life, enabling you to experience the world to its fullest. This fist-sized powerhouse, small yet mighty, pumps about 5 liters of blood every minute, circulating through your entire body in a matter of seconds. That's an astonishing feat of engineering, a testament to the heart's efficiency and power. Without a single day off, it works tirelessly, 24 hours a day, 7 days a week, 365 days a year, never faltering in its vital task. The heart, like any engine, has its own fuel lines, the coronary arteries, a network of vessels that wrap around the heart itself. These crucial arteries supply it with the oxygen and nutrients it needs so it can keep working, ensuring its own survival and continued function. With 4 chambers, 2 atria and 2 ventricles, and a series of intricate valves working in perfect harmony, the heart ensures blood flows efficiently and effectively in the right direction, preventing backflow and maximizing oxygen delivery. The right side of the heart diligently sends blood to the lungs for oxygen replenishment, while the left side powerfully pumps this oxygenated blood to the rest of the body, nourishing every organ and tissue. However, when the coronary arteries are compromised, narrowed, or blocked, the heart's own fuel supply is critically threatened, leading to potential damage and dysfunction. One of the most serious and life-threatening consequences of this compromised blood flow is a heart attack, a crisis in the heart's own supply line where a portion of the heart muscle is deprived of oxygen and begins to die. The most common cause of a heart attack is coronary heart disease, where the coronary arteries become narrowed by plaque. Plaque is a fatty buildup like limescale in pipes that slowly restricts blood flow, a process called atherosclerosis. Risk factors include age, family history, and being male, but lifestyle choices play a huge role. High blood pressure, high cholesterol, smoking, obesity, lack of exercise, and diabetes all increase your risk. These factors often combine, silently building up plaque over decades. Often there are no symptoms until the arteries are severely narrowed. That's why managing your risk factors and regular checkups are so important. Let's take a look inside the arteries, the vital pathways that carry life-sustaining blood throughout your body. Picture a healthy artery as a smooth, flexible tube, a superhighway for blood, with blood flowing freely and efficiently. The artery walls are elastic, allowing them to expand and contract with each heartbeat, ensuring a consistent and optimal blood supply to all your organs and tissues. However, this smooth flow can be disrupted. Atherosclerosis, a common yet serious condition, begins when the artery's inner lining, the endothelium, is damaged. This damage can be caused by a number of factors, including high blood pressure, which puts excessive force on the artery walls, or smoking, where chemicals in tobacco smoke injure the endothelium. Other culprits include high cholesterol, diabetes, and even genetic predisposition. Once the damage occurs, the body tries to heal the injury, initiating a complex repair process. But instead of a clean repair, cholesterol, fats, and other cellular debris start to build up at the site of the injury, forming plaque. This plaque accumulates gradually over time. This plaque isn't uniform. It typically has a soft, lipid-rich core and a hard, fibrous cap that covers the core. As plaque grows and hardens, the artery narrows, a condition known as stenosis. This narrowing restricts the space through which blood can flow. This narrowing reduces blood flow to the heart muscle, potentially causing chest pain, also known as angina, particularly during physical exertion when the heart demands more oxygen. However, the most immediate and severe danger arises when the plaque ruptures or tears. This rupture exposes the soft, vulnerable contents of the plaque's core to the bloodstream. In response to this exposure, the body initiates a rapid defense mechanism, rushing to form a blood clot at the site of the rupture. This is the same process that occurs when you get a cut. The body immediately starts clotting to stop the bleeding. Platelets, tiny blood cells responsible for clotting, and other clotting factors quickly pile up at the rupture site. This rapid accumulation leads to the formation of a blood clot, medically termed a thrombus. Now imagine this clot forming in an artery that's already narrowed by plaque. In such a situation, this clot can completely block blood flow. When that happens, the heart muscle downstream from the blockage is suddenly and severely starved of oxygen, a condition called ischemia. This critical moment when the heart muscle begins to die due to lack of oxygen is the moment a heart attack strikes. When a coronary artery, one of the vital vessels supplying blood to the heart muscle itself, becomes blocked, it creates a critical situation. This blockage, often caused by a blood clot forming on top of plaque buildup, obstructs the flow of oxygen-rich blood. As a result, part of the heart muscle downstream from the blockage is suddenly cut off from its essential supply of oxygen. This deprivation is known as ischemia, and it sets off a chain of events that can lead to irreversible damage. The affected cells, starved of oxygen and nutrients, begin to die within minutes. This cellular death, called necrosis, is the hallmark of a heart attack. And the longer the blockage persists, the more widespread the damage becomes. The area of dying tissue expands, compromising the heart's overall function. The extent of this damage directly impacts the long-term health and well-being of the individual. Dead heart muscle, unable to regenerate, is gradually replaced by scar tissue. This scar tissue, while providing structural support, lacks the contractile properties of healthy heart muscle. Consequently, the formation of scar tissue weakens the heart's ability to pump blood effectively throughout the body. This reduced pumping capacity can lead to heart failure and other complications. The affected area undergoes a visible transformation. The area turns from healthy pink, indicating a rich supply of oxygenated blood, to a bluish hue, a condition known as cyanosis, as it loses oxygen and blood flow diminishes. This color change is a clear indication of tissue damage and oxygen deprivation. Furthermore, this oxygen deprivation and tissue damage can disrupt the heart's delicate electrical rhythm, which controls the coordinated contraction of the heart chambers. This disruption can lead to the development of dangerous arrhythmias, irregular heartbeats that can compromise blood flow or even trigger cardiac arrest, a sudden cessation of heart function. That's why every minute counts, because the longer the heart muscle is deprived of oxygen, the greater the extent of irreversible damage. Therefore, emergency treatment aims to restore blood flow to the blocked artery as quickly and efficiently as possible, minimizing the damage to the heart muscle. Clot-busting drugs, also known as thrombolytics or angioplasty, a minimally invasive procedure to physically open the blocked artery, can effectively open the artery, restore blood flow and limit the extent of permanent damage to the heart muscle. The faster the treatment is administered, the better the chance of a full and successful recovery, preserving heart function and improving long-term outcomes. Recognizing heart attack symptoms early can save lives. The most common sign is chest pain, often described as pressure, tightness or squeezing in the center of the chest. This discomfort can spread to the arms, jaw, neck, back or stomach. Other symptoms include lightheadedness, cold sweats and shortness of breath. Some people feel overwhelming anxiety or a sense of impending doom. Nausea and vomiting can also occur. Not everyone experiences all symptoms and intensity varies. Sometimes symptoms are mild or come and go. The key is to recognize the pattern and act quickly. If you suspect a heart attack, seek help immediately. Heart attack symptoms can be subtle, especially in women, older adults, and people with diabetes. Instead of chest pain, they may feel extreme fatigue, shortness of breath, or pain in the back jaw or upper abdomen. These symptoms are often mistaken for other problems like indigestion or muscle strain. The discomfort may be mild, gradual, or come and go over hours or days. Delaying help is dangerous. Every minute counts. Listen to your body and trust your instincts. Sudden dizziness, unexplained sweating, or nausea should never be ignored. When in doubt, get medical help right away. If you suspect a heart attack, act immediately. Time is muscle. Call emergency services right away. Don't drive yourself. Paramedics can start life-saving treatment on the spot. While waiting, help the person sit comfortably and stay calm. If they're not allergic, have them chew one adult aspirin to help thin the blood. Please refrain from giving them food or drink, as an empty stomach is an added advantage in minimizing complications during an operation, should this later become necessary. If they become unconscious or stop breathing, start CPR as instructed by emergency operators. Do chest compressions, keep blood flowing until help arrives. Quick action can mean the difference between life and death. Please contact your doctor immediately for any medical concerns. This video is intended only as informational. For more top health awareness stories like this, please like, share and subscribe.